rise and join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We've had the minutes distributed in your packets via email, and assume everyone's had an opportunity to read them over, and I'll entertain a motion to approve them as submitted.
Well, I've made some revisions, but I
Well,
move to
they're,
approve them.
yes, all of your revisions have been incorporated. Any second? Thank you. The motion has been made and seconded to approve the minutes. Any additions or deletions, corrections? Hearing none, all in favor of approving the minutes, say aye.
Aye.
Any contraries? Hearing none, the minutes are approved. At this time, I'd like to welcome our newest member of the Board of Health, Ms. Mary Ann McCarthy. Ms. McCarthy, I wonder if you could take a couple of minutes and let our viewers know something about your background and what brings you here.
Thank you very much. First, I would like to thank the board for the warm welcome and for the commissioners for appointing me. I taught in Radnor schools for 38 years, and the emphasis was on health education and the development of the health curriculum 1 through 12. And that is my passion, and I'm honored to serve the township in another way by joining this Board of Health.
Thank you, and again, a very, very warm welcome. I'm sure your inputs, especially with regard to the education of our young people, will be very, very important. I'd also like to welcome Mr. John Nagel, who's Township Commissioner, and very importantly for our purposes, he is this year's liaison to the Board of Health from the Commissioners. And welcome, Mr. Nagel. Thank you. One of the items of business for our meeting this evening is the election of officers. We actually have two, President and Vice President of the Board. At this point, I'd like to hear any nominations for Vice President.
My question is this, we're talking at the end of this year that there may be some people leaving the board, and is this a 2-year that we're doing, or?
Traditionally, if not by regulation or charter, the officers of the board are elected annually at the first meeting of the new year, which of course is in January most of the time. The appointments as members of the board are for 4-year terms, with the restriction being that no one can serve more than 2 consecutive 4-year terms. So that's for membership. But and those appointments are made by the Board of Commissioners of the Township. But the election of officers is by the members of the board, and as I said, it's annually.
Well, if we're nominating for Vice President, I'll nominate Amy Wishner.
Any second? Dr. Foreman has seconded that. Are there any other nominations? Hearing none, I'll hear a motion to, well, rather than have a motion, since the nomination has been made and seconded, All in favor, say aye.
Aye.
Any contraries? Hearing none, congratulations, Amy. You are now the Vice President for 2013. And at this point, I'll relinquish the chair temporarily to you for the purpose of electing the President.
So I will open the floor to nominations for president.
And I'll nominate Herb. Suzanne? Their term?
Do I hear a second?
I'll second.
All in favor? Oh, I'm sorry, do we have any other nominations for president? Hearing none, I will call it for a vote. All in favor? Aye.
Aye.
Are there any nays? No? Congratulations, Herb, you've been unanimously reelected as president of the board for 20.
Well, thank you again for, as in previous years, for that vote of confidence. I should point out, along the lines of Dr. Donato's question, that 2013 marks the last of my second four-year term, the last year of my second four-year term. So I will be, in fact, ineligible to be a member of this board after December 31st of this year. And I'll have more to say about that near the end of the year, but I think we all need to be cognizant of the fact that the leadership will have to turn over to someone else. And
Mr. Chairman, I'd like to point out, though, that you certainly could be reappointed in 2015. Just something to keep you up at night.
thank you for that. No, I seriously, thank you. At any rate, let's move on to announcements by Mr. Taltone, the health officer, and you can segue right into your report, Mr. Taltone.
Thank you, Mr. Chairman. Good afternoon to the board members and Mrs. Claudia, our secretary. Thanks for being here tonight. Today I'm going to give you a year-end report for 2012. This report consists of a time period from January the 1st, 2012 to December the 17th, 2012. During the month of December, the last part of the month and the first of December and the first part of January, I'm pretty busy with renewals of the 200 and some, 202 I think it is, licensed food establishments that we have. So that's why the date stops at 12/17. During the course of the year, we inspected 287 food establishments for food safety, 122 bathing places, 6 rental housing. These are for new rentals. The rental housings were split up with the other 2 inspectors. I handled 81 of 223 quality of life issues, ranging from animal-related issues, food establishment-related complaints, and property maintenance-related. Can range from hoarding to bed bugs and trash and the like. I also work with Department of Agriculture. I am, or Radnor Township, I shouldn't say I, but Radnor Township is the first local municipality in the state of Pennsylvania to place their food safety inspections online. It is a state mandate that they've mandated that we do that, and we can do it one of 2 ways: either report to the Department of Agriculture, who puts it on their website, or we can do it ourselves. They have, at least on a temporary basis, allowed us to do it this way. So we're the first one in the state to do that. I have maintained certifications as a Pennsylvania State Health Officer, Certified Food Safety Professional, Lead Inspector, Risk Assessor, Residential Building Inspector, and a Certified Building Code Official. This year we hosted a rabies awareness, safety, and prevention clinic here at the Township. We invited local health people from Montgomery County Health Department, Chester County Health Department, Philadelphia, and all the local health officers in Delaware County. It was put on by Dr. Howard Russell, who is a veterinarian, and Peter J. Costa, he's a Master of Public Health and the Director of Global Communications Global Alliance for Rabies Control. I maintained 15 certifications in the NIMS program, National Incident Command Center. We also had this year a big turnover and influx of new food facilities. We've had 21 new licensed food establishments in Radnor Township. A couple of these were changeovers from, someone selling to another vendor. For example, Gennardi's changed over to Giant. But we had, just to name a few, Jules Thin Crust, Piece of Pizza went from Piece of Pizza to Meltdown. They just changed their menu type thing. Red Mango, Mr. Zebra Ice Cream. Chili's decided to rebuild. They liked it here at the township, so they decided to rebuild here. Some new vendors in the farmers market. Where Johnny's Doghouse left, we had Creperie Bechamel that came in. Villanova campus put a new eatery for the students there. Likewise, did Cabrini on campus. They put a new one. We have Papa John's, another Subway. We have a couple of new food trucks also. Sweet Box Cupcakes, food truck, and we also have a new barbecue vendor in the farmers market. So there's a total of 21 new licensed facilities in Radnor Township, and that's an increase from about 100. It was right around 190 last year. So with the changeover of new ones and some moving out, we're right around 200, a little over 200. I work with the Pennsylvania Department of Health, Delaware County Intercommunity Health, and Delaware County Local Boards of Health in providing flu shots at the Tennicum Township. At that venue, I believe we did a little over 500 flu shots. Before, in prior years, that was a drive-through flu shots, and one year we actually did 1,200, but this year it was a little less, it was 500, which is still good. We supervised numerous home quarantines for cats that were potentially infected with the rabies virus under the Chapter 115 Animal Ordinance. I'm also been drafted into a membership of the Philadelphia Area Food Safety Task Force, which is a new group that's been recently formed to come up with ideas and education for food safety inspectors to promote food safety. I'm also a member of CASA, PACO, National Association of Local Boards of Health, National Environmental Health Association, and I continue to look forward to serving the residents of Radnor Township. And so ends my report.
Thank you. Are there any questions for Mr. Taltone?
Well, first of all, I just want to say it's extremely impressive, and we are so very fortunate to have somebody as motivated and qualified and always seeking new information, new certifications, leading the township in the state in many areas. So, I mean, a lot of what you do is invisible to the residents, and that's a good thing, because if you weren't doing it and we had more problems, then it would be visible. So you're sort of an unsung hero, and thank you so much for all that you do. Really appreciate it.
Thank you very much.
I had one question just related to something I caught on the radio the other day. It was talking about how sliced up pig intestine is being sold as calamari. It costs about half as much as calamari, and it sort of led to this larger discussion. It was on NPR about how about half the time, the fish that you order is actually a different fish than the one that you think you're ordering. And I just wondered, and they were making the point that the whole food safety regulations are designed around sort of sanitation and they're not really sort of set up to detect this kind of thing. And I guess I just wanted your sort of 2 cents on that, about what you think and, just your thoughts on it.
Yeah, I didn't hear that particular report, but that is something that's pretty prevalent in the industry, where, to me, it'll be pretty difficult to substitute pig intestines for calamari. Coming up, we call those chitterlings, pig intestines. But it is a pretty prevalent thing, and it's one of the things that in the Food Safety Task Force, it's on our agenda to look at. We have people in that group from FDA, Howard Rabinovich, and people from agriculture. So it's people all across the board. We have quite a few epidemiologists. So I do know that that's one of the things we're going to be looking at, and it is an issue in the industry. So
Because it's not sort of directly an issue of food safety,
Right.
If you think you're ordering one fish and you're getting another, if it's, stored at the proper temperature and, cooked to the proper temperature and et cetera, you're not eating something unsafe, you're just eating something different than what you requested. So it's interesting that it's on the test. So I guess you're looking at maybe sort of quality and safety.
Well, many people don't understand, and a lot of health inspectors really don't get the full understanding of who inspects what at what period. We have people on the FDA level who may look at it at certain things. Local health officers really look at it on the retail level. Where you go into the restaurant, you sit down, and you order something to eat. That's where I have more control. Where, other groups might inspect it as it's coming into the country. Others might inspect, for example, FDA inspectors might inspect the processing plants. So that's one of the things we have to iron out as regulators and do a better job. So it is a prevalent issue.
I guess I'll just ask that you keep us sort of up to, just periodically report on what's happening with the task force. Another sort of area that I've been interested in, and that seems like this task force might potentially have the sort of people to help with, is the farm to school thing, because on the one hand it is a USDA initiative, and something the USDA is very interested in promoting. On the other hand, obviously it comes down to local connections and, figuring it out on a local level. But among the people in the task force and the different localities in the task force, there may be some that have already been moving ahead on this, and they might have sort of lessons learned, things to avoid, things that worked well for others, and there might be a way for us really to move ahead as a region in this, which would really be great. So maybe it's appropriate for this task force, maybe not, but I wanted to bring it up in case it is.
I would definitely keep you posted. Maybe I can take you with me to one of the meetings, or at least one of the board members.
Yeah, I'd be very interested in doing that.
Thank you. Any other comments or questions for Mr. Taltone? Hearing none, let me, since we're on food, I do recall that at one of our previous meetings towards the end of last year, we talked about the farm to school program, and I know, Amy, you were especially interested in that, and we talked about how we might follow up with the school district to find out what their plans are with regard to that. Can you report on that?
Well, everybody who I emailed, who we talked about, did not respond to me. So the principal, the director of cafeteria services, the school liaison here. So that sort of was a dead end. I did get a response. I mean, I just emailed Brucey Rappaport, who's on the school board, and she suggested I contact the guy who's the business manager for the schools, because I was just trying to get the information, sort of the basic information about how are the contracts done, how far out are they done, because, you know, you had some good suggestions, like we need to get this basic information to even see sort of when one needs, you know, do you need to deal with this a year in advance, 2 years in advance, 5 years in advance, you know, and how have other places managed to do this. But just, I was talking with Marianne ahead of time and with Claudia ahead of time, and so maybe each of you could also say what we were talking about so we can get that on the record, because both of you also had good suggestions on this.
So I suggested that I could go to clubs in our school to see if anyone would be interested in this, and they could possibly like start to sponsor us or something with the farm to school idea. Or maybe, or Mrs. McCarthy said, a grade maybe would be interested in it as a class project.
My suggestion would be, rather than just email the principals and Tim Vale, to ask to meet with them and the head of food services and get clear answers on your questions. It's always most helpful if you go in with a template, where this has been done, how it's been done, and make it feasible. And then you may have more success with that type of approach. But I like the idea of starting with the administration, the school board, and the powers to be, explaining your interest and the Board of Health's interest and what's going on. And then, because you can't go right to the students, you have to have the approval. But there may be interested parties once you have all the details.
Can I prevail upon you, Ms. McCarthy, to join Ms. Wishner in that effort? I think this could be a very important issue for us to tackle during this year. And I think with your experience and your tenure with the school district here, I think you would be very valuable to us in terms of helping us to gain entree to the right people.
Yes, sir, I'd be happy to assist.
Mr. Chairman, also Lisa Borowski's the school board rep that's responsible for the intergovernmental, I'm not sure that's the right name, committee. Talk to her also and let her know that we're interested in this kind of thing. And you know, the community garden that was started in Skunk Hollow this year was a huge success. And that's something else that might work involving students. In the past, when we had the CSA there, the students were tremendous.
That's a good suggestion. Also, one other thing with regard to this, and even, let me just throw this in. I think at some point, even before contracts are let, and again, I don't know the timeline, but specifications have to be developed by the school district for those contracts. If we could possibly get our hands on those specifications and look at them and see where we might be reasonably able to make inputs, that would be terrific. So I think that's something we ought to be looking at first and foremost.
Mr. Chairman, if that's what you believe needs to be looked at first, I would suggest that you ask Mr. Kane or send an email directly as the chairman of the Board of Health to Dr. Grobman and ask for that. And hopefully that will be a response given to you.
follow up on that. Okay, anything further on that subject? That seems to be a good intro to a couple
I
of
mean,
our...
I just want to sort of reinforce, but I still think, Claudia, if you could sort of just kind of look over the school clubs and see if you, at the high school, and just see if you see anything that seems, you know, sort of potentially, because I think it's a top-down and bottom-up thing. So I wouldn't say let's only try and deal with the administrative end. I think if there are any students or group within the school who are interested as well, that could only help.
I know we have a bunch of clubs, and I
Yeah.
think there's one that is about like the environment, and they would probably be interested in doing something like that. So I can look into that.
Anything further on that? Okay, that's a good intro to two of our old business topics. On the teen health issues, that's a reference, of course, to the posters that were developed. Dr. Leader had a conflict due to the change in our regular meeting date from the third Monday to the second Monday that she couldn't get out of. So she's unable to be here. I know, though, that meanwhile, she is not neglecting the topic. She is working with Mr. Kane. Apparently, some piece of technological equipment, and I don't really know what it is. It's something that you plug into your computer that she has, and that she had delivered to his office, got lost. So he was unable to look at the posters and print them out without that. And she was going to try and get him a copy of that so that he could work with it. And that's in process. Mr. Kane also had a conflict due to the change in the schedule, and he could not be here tonight. But be assured that it is being worked on. Childhood obesity, that's the subcommittee that you and Dr. Saldivar are working on. She's not here yet this evening.
We had, I mean, I see it as very related to this farm to school, you know, I see that as one activity of that group, but yeah, we just had this cross communications. So we did have a meeting set. I showed up. I left after a while. Then she showed up, and then Claudia hadn't gotten the message yet. So we still have to get that together.
Okay. Are there any other issues that board members think we need to be addressing in 2013?
Did want to follow up on something we had mentioned before about fracking and whether wildlife was in fact any kind of sentinel or concentrator of possible, you know, environmental impacts. And I didn't know if you'd had a chance to investigate that at all.
Yeah, at the moment, one of the things that I'm looking at are, you know, is anybody doing anything new related to the, in essence, you know, byproducts of fracking? And there's talk among a lot of the wildlife specialists. Nothing is formalized yet, and probably, I would imagine, they're working on their grants and whatnot to get funding for that. So at the moment, nothing directly, you know, as they find some of those, you know, indirect, you know, byproducts of fracking, they'll probably first turn to old research. That's what it looks like is happening, and tie that in with some new research that'll be done. But again, nobody's doing anything 100% concrete yet because it's taking time to get it together. There's some, I don't want to say anecdotal, but there's some literature right now that's taking some jumps that they are saying, well, these are some of the byproducts, and this is what it's done in the past to certain populations, but nobody's done one specifically of that area yet, or if they're going on currently, I'm not aware of them. So, I'll keep my eye out for that stuff, though.
I mean, another thing I was thinking about in regard to this is also just the noise and the sort of disruption of the environment, because the program that I went to at the College of Physicians that sort of just was the start of this discussion. I mean, people were talking about that a lot as far as the impact on people was the noise. So I have to think that would have an impact on the wildlife.
Yeah, I'm sure there's some population changes, population biology happening that, again, just I'm sure it's a little too early to make any assumptions yet. But I know there's discussion amongst my colleagues. I'm just not sure they're quite there yet. It may take many years, but in the meanwhile, some of the things that I am looking to do this year is to identify the big offenders, the big chemicals getting into the environment, and seeing what we know from the past. So hopefully that can help give us an idea of what to look at in the future.
Are there people at the state level that we should be, or you on our behalf should be communicating with? I mean,
Yeah, and there definitely are, and again, those are some of the people that I've kind of briefly chit-chatted with, and there's a process that they are going to go through, and definitely will be looking at it. But I think it is a lot of it is dependent upon funds, and as we know, there's not a ton of that to go around at the moment, but hopefully we will see some of that pretty soon. But yeah, all those discussions are going on among some of the private institutions and some of the, from PA State as well, Department of Ag and those guys. Yeah, a lot of conversation happening, no doubt. I'm sure progress is going to be made at some point, probably not in the too distant future.
Okay. Is there any other old business item? Hearing none, we'll move on to new business. And but before I do that, I should mention that at its last meeting, which I believe was last week, the Board of Commissioners did take up this board's submission of proposed revisions to Chapter 115. And a couple of our absent board members, one of whom is having surgery and another one of whom has had a death in the family, and our condolences go out to her, I'm sure, have asked that we defer that issue, a discussion of that issue, and hopefully, Mr. Nagel, you'll be able to be at our February meeting. No, you won't be. That's right, you did tell me that.
I'd be more than willing to meet with people outside of this meeting. I provided you with a summary of the points I captured from our discussion, which hopefully you'll share with the entire board.
Yes, I have.
And
I think I have.
like I said, I'll be happy to meet with anyone separately to discuss that.
Okay, well, we'll work something out between now and our meeting in February. As a concession to those folks who've worked on this, I felt it needful to defer that discussion by this board. The But that brings to mind, Mr. Taltone, that we've had some new board members. Ms. McCarthy is one, and Dr. Saldivar is another, who may not have had a chance, maybe even Dr. Foreman, since it was over 2 years ago, that we made that submission, who never had a chance to look at our proposed revisions. If it's at all possible for you to send those to those folks via email, I'd appreciate it, so they would have a basis for any discussion we'll have in February.
I'll send it to him. I'll send it to him.
Thank you. Now we'll move on to new business. And as I'm sure most of us are aware, we listen to the news, the country is in the middle of a serious flu outbreak, while in some states are reporting a leveling off or even a downturn in numbers of new cases. Other areas are reporting upswings. The state of New York a few days ago declared a public health emergency. In that regard, the city of Boston did likewise due to large numbers of people showing up at hospitals. I had asked Dr. Avedian to try to be with us tonight, but he is out of town today and is unable to be here. I wanted him to report on what the county has been doing, what he in particular has been doing. Dr. George Avedian, as we know, is the senior health advisor to the Delaware County Council, rather. He did send me an email in which he just bulleted his activities, and I'll just go over them. But while I'm doing that, and while we discuss this further, Mr. Doling will be putting on the screen websites that our viewers and the citizens of Radnor can access if they wish to have more information. Those websites would be the CDC's website, the state's website, the counties, as well as the townships. So all of those are good sources of information for our citizens, and I would encourage anyone who's interested in getting up-to-the-minute information about flu itself, what it is, what the symptoms are, what you need to do to protect yourself, and what you need to do if you get sick. All of these websites have information. In addition to that, Dr. Avedian has had informational flyers posted in public locations throughout the county, libraries, government buildings, and senior centers. He's held educational community forums stressing the importance of immunization. With the Pennsylvania Department of Health, free flu clinics have been conducted. There was a free flu clinic for county employees. He's had frequent postings on his Facebook and Twitter accounts. He's made updates to the county council and frequent updates and informational pieces on the county website. And he's also met with the municipal health officers, and Dr. Avedian has in particular asked me to express his gratitude to Mr. Taltone for his attendance at those meetings. And he will have an ongoing weekly educational piece on brandywineradio.com. Brandywine Radio is one word, spelled just the way it sounds, .com. And they will also continue screening and educational programs in the wellness van that the county has. At this point, I'd like to ask Dr. Foreman for any information that he has to add.
Obviously, it is a high-activity flu season this season. It's about triple what it normally is. Generally speaking, it's about a 2% rate across the country this year. It's closer to 6%, although in the last week there's been CDC statistics saying it's coming down to 4.3%, and it's unclear whether that's just a fluctuation in the season, as it always goes. There's always a fluctuation within the flu season about severity of disease and how much it spreads. Certainly having to do with the holidays, we see sometimes a break in the amount of flu that goes around, considering people are at home rather than at work and at school. So I can expect this number to probably come back up again in January, when January's final numbers are out, rather. As far as information that we might be getting on the news a lot, I think some of it is confusing. Recent studies have been done on the flu vaccination showing about a 60% effectiveness, where childhood vaccines are in the above 90% effectiveness. It seems like 60% is a low number. It is lower than other vaccinations. However, it's still the only tool we have to prevent the flu, and an excellent tool in that. The effectiveness number is calculated by people who got the flu vaccine and then were seen by their doctor for flu-related illnesses. So there is some variability in those numbers as well. There's many people who probably never visited their doctors that weren't reported and got their flu vaccine at a local pharmacy. So I think that the numbers are a little bit difficult to interpret. It's still the best way to protect yourself is with a flu vaccine. The flu vaccine seems to be more difficult to get as we get later in the season, and I think it becomes a little bit of a panic for people when they see the news and they want to get a vaccine. There are a few resources in the area where we know we can still get some flu vaccine. Certainly the counties have been, Dr. Vedian said, have been giving free flu clinics. I know that the Chester County Department of Health still has flu vaccine and free walk-in clinics for any resident of Pennsylvania. You don't have to be a member of Chester County. You can be anybody. And their number is 610-344-6252. And they have a number of days they do walk-in flu vaccination for a small fee. CVS's in Bryn Mawr, Rosemont, and Newtown Square are out of flu vaccine as of today and are expecting more in tomorrow. I spoke with the pharmacists in those 3 pharmacies today. So 3 Delaware County, I believe, all Delaware County have pharmacies that will have those in stock soon. And many of them get them in waves. They'll get them in as shipments come in. So there is some vaccines available. There have already been 20 deaths this year, probably more, remembering that the populations that are most at risk are the elderly, the people who have chronic illnesses, and the young children, especially young children who cannot be vaccinated yet prior to 6 months of age. So all, hopefully, information we can use.
Thank you.
Those 20 deaths are in Pennsylvania, correct?
I think so, yeah.
Yeah. One of the things that people think is that due to this point in the season is that it's, and given the fact that we have this outbreak, that it's too late to get the vaccine. Is that?
Right. Flu season in Pennsylvania really lasts into March, so I think it's a good idea for anybody who hasn't had it yet to still get it. It takes about 2 to 4 weeks for you to get some immunity from the vaccination, so you're certainly still in the range of protection if you get it now.
The other thing is that while the effectiveness of the vaccine has been reported by the CDC is, as you've indicated, in the low 60s, isn't it also true that if you do get the flu and have been vaccinated, you're likely to get a milder version of it?
There's some indication of that you have a milder version. There's also indication that if you get your flu vaccine yearly, you may have some cross protection, although mild, from year to year. And the third thing to remember is that the flu vaccine strain is guessed every year. They guess on 3 strains of the flu, and in one type of vaccine, they're also guessing on 4 strains of the flu this year. And some years that guess is very good, and some years the guess is not very good, and that also affects how effective the vaccine will be against the season's flu. Interestingly enough, this year's flu vaccine, with the numbers they're getting into the CDC nationally, it's about 90% of the strains that are circulating are in the vaccine. So it is a good guess this year, and so it does offer protection.
I just wanted to add a couple of things. One is that in Pennsylvania there have been no pediatric flu deaths from the flu vaccine, from influenza this year so far, but there have been 2 deaths among previously healthy people younger than age 50. So, so that's another kind of myth that, oh, if I'm healthy, I don't need the vaccine. I mean, other myths to address. It is a myth that you can get the influenza disease from the flu vaccines. You cannot get it. You cannot get influenza disease from flu vaccines. Antibiotics will not help against influenza. Sometimes people develop other health problems such as pneumonia or other illnesses that may be susceptible to antibiotics, but Tamiflu is an antiviral medication and is considered to be quite helpful. There was just some new research out on it I saw today. They've started within the first 24 hours-ish of symptoms. So certainly if people are feeling ill, they should contact their physician, but not to take leftover antibiotics that you may have left from something else, because you can actually be breeding a more dangerous organism by doing that. Another resource to find where to get influenza vaccine is the American Lung Association. They have and their website is www.lung.org, and you can enter your zip code, and they'll give you a list of area, pharmacies, hospitals, any place in your area that might have flu vaccine. It has the phone numbers. In some cases, it has the cost. So you can see right there, okay, I'm closest to these 4, because the Rite Aid drugstores are also listed there. I'm closest to these couple of places. Let me call them and see if they have vaccine. So it makes it easy to do. And also Montgomery County, same as Chester County, also has flu clinics for anybody who, you don't have to be a resident of Montgomery County. So I wanted to mention that as well.
Any other?
I have a question, being the novice on the board. What methods of communication with Radnor's Township residents do we have other than the email and if they should watch while we're meeting?
It's interesting because we do, the township, it's not the board per se, but the township also has, emergency, communications. I mean, I've gotten phone calls from, about various emergencies, and I guess it would be kind of interesting. And maybe I wanted to bring up about what it means to declare a public health emergency. I mean, the only thing I saw, because I was looking to see, okay, well, so what does that mean that Cuomo declared a public health emergency? The only thing I saw that was in the news coverage of it was that he has somehow, because it's called a public health emergency, that enabled pharmacists to start being able to legally immunize children 6 months of age and older, whereas prior to it being called a public health emergency, pharmacists, and in Pennsylvania as well, are restricted to adults, to people 18 years of age and older, in terms of their legal ability to immunize people. So, but I don't know sort of what else it means to declare a public health emergency or what additional powers that gives you. But I guess, and it sort of raises the question, if the board decided this or some other issue was kind of worth it to utilize this phone system to notify all township residents of something. So in this case, it would be, if you haven't gotten a flu vaccine and you're eligible, please try and get it or whatever. But let's say something else came up that we thought, how would we go about doing that? And it is the kind of thing that we should know about. So if we needed to use it, we wouldn't be trying to figure it out at that point. So I don't know, Mr. Taltone, if you know that about how that system is accessed, or would you be our conduit to it, or?
I don't know how a public emergency is done. I would assume it's done through the governor, but I don't know the answer to that. I can try to find out. As far as a phone blast, I can check with the township manager and see what his thoughts are, but I don't know the answer to that either. I'm sorry.
We have the code red, it's called. And if there were something like that, it would just be necessary to let Larry know. You probably provide the text you want read, and then he could take care of it internally of the township.
I was thinking more on prevention. And
The township issues a weekly newsletter, but they're subscribers, so they don't go to everyone. And there are quarterly newsletters that this board could put an article in. So,
I think that's more what I'm
yeah.
thinking along the lines of, because if we have to deal with this until at least March, I was thinking on the lines of notices to schools, health clubs, the PSC, 3,000 people a day go in there. And churches, you know, there's the sign of peace. People either shake hands, some hug. Maybe this is not the appropriate season to do that. Restaurants, those kinds of things, to be a proactive board so that Radnor Township's dealing with the flu would be less if we actually put some of this. Claudia, I was also thinking at the high school in the morning announcements, and the middle school, the morning announcements, it is imperative that young people take the time, or teachers end the classes 4 minutes early, to give you the time to wash your hands before you go to lunch, because in grades 6 to 12, they will just go, trust me, from years of service, I know, they will just go straight for the food. So there has to be, in my humble opinion, this board needs to be proactive on this to lessen our cases and the impact on our community.
I think we definitely can get a message out in the announcements. I can look into that. And then also, I know that we have like the Purell hand sanitizer things all over, so we can maybe like put up signs or something advocating for to use them instead of just ignore them.
And while signs are great, you and I both know, Claudia, once they're up, you don't see them anymore. So the reality is, it is the adult in the room that says, hey, I'm stopping 3 minutes early. You know, half you girls go, wash your hands, come back, the other half go, that kind of thing. I'm just thinking of more positive ways to alleviate this if we can. Maybe it'll work, maybe it won't, but I mean, just at Mass this weekend, truly, there were people that were coughing, sneezing the whole time, and then they should not have been giving the sign of peace. It was like, let's spread it right here.
I was going to say, in years past, I know before the flu season has started, we may have done like a Radnor Health Matters, where it's almost like a mini television program filmed from right behind this wall over here that gets played a number of times throughout the month. So these are some of the things that it's great to do, and unfortunately right now we're at a high point in the flu season where it does make it challenging to get some of these communications out. But you know, we can be talking about using the telephone system at this point, because that is the most rapid way to get things going, to make a push for this last month and a half that the flu will be really upon us. But there's a number of different communications that we have used. People are saying, you know, being a newcomer to the board, and those are things that, you know, I think that we can continue to implement. And right now, maybe for the flu and making a last push, maybe the phone system is a good idea, or getting something on the website, something on the scroll. These are all things that I think we agree are good ways to communicate with the residents of Radnor.
Well, Mr. Taltone has indicated he will find out about the phone blast, and two things, whether and how we go about doing that, and what is the length of any message that we would, I know that it worked very effectively during the lead up to Storm Sandy, and getting information about where the shelter was when the high school was set up as a shelter, and we got all of those calls at home, and I assume everyone else did as well. But this could be a very effective tool for us to use, not just for this, but for any future circumstance where we need to get something out in as rapidly as possible and to as many people as possible. So I'd like to know, A, if we can use that system for this purpose, how much time is usually used for any phone blast message, and 3, I'll look for volunteers from this board to develop the content of any message that we might get out. And please funnel that back to me as promptly as you can.
I'll try to get back to you, but no later than tomorrow afternoon.
Thank you.
Dr. Foreman is volunteering.
Thank you. I will get back to you as soon as I hear about the length of time so that we would have, so you can tailor the message to that. Thank you.
Also, a question I have, and your experience may know the answer right away, but do we track the absenteeism in the schools during flu season? And possibly how many visits to the nurse that they have and they don't get home? Because in today's world, we need to encourage the students to stay home if they're not well and encourage the parents to keep them home. So do we have that information, absenteeism? Mr. Kane probably could provide that for us to see where the flu is in Radnor schools, at least the public schools he'd be able to provide.
Well, he certainly would be the first stop in trying to get that information. When you say we don't have that information, but the school district certainly does, and I assume that they have a mechanism for tracking that. We also need to bear in mind that not all of those absences that that parents might indicate are flu are necessarily flu. There'll be flu-like symptoms that their children have, and they're correct to keep them home for that as well. But I can get in touch with Kevin Kane and ask him that, unless you'd like to do that.
I'll be happy to do it at your direction, sir.
Thank you. Please.
One other thing then, we're talking about getting a phone alert out to everybody and maybe something on the scroll on the Radnor network. But then there was also a mention of student announcements or a student announcement, and I guess I don't know, hate to say, what that might entail. Are we encouraging them to get immunized, washing hands, all of it? Is that something that even the school will do? And is that another question for Mr. Kane?
Yeah, I mean, I think also, those were the things I was thinking of, wash your hands, cover your cough into your elbow, stay home if you're sick, as a courtesy to your fellow students and your teachers. And get if you haven't not yet gotten your flu vaccine and you don't have a true medical reason not to, talk with your parents and see if you can get, those were the kinds of things I was thinking of.
Okay.
What I think in the schools works is you need a point person that has to sign off on the announcements so before they go up. Does that still happen, Claudia, in the high school?
I'm not sure exactly what happens, but I believe that the class president does the announcements.
I think the school nurse would be the logical person.
Yes, so it's consistent
For
and,
the school physician would be even better, because that's a school physician for the whole district. So if the school physician said, here's something I would like announced in every school in the district, that would be even better. I don't.
It was Dr. Rockland Walker, but I don't know if it still is this year. Ms. McCarthy, when you talked to Mr. Kane about student absenteeism, could you also find out if he knows anything about staff absenteeism? Is it on the uptick? Thank you. Let's find out more about, from Ms. Cardinal, about the requirements for announcements at the school. And among other things that, well, let's take it, we'll do that phone blast as well. I'm sure that'll come about.
I just wanted to say that I think it's important, if announcements do occur, that they're accurate and concise, and they need to be repeated. And I don't think it's our place, in my personal opinion, to tell them to get vaccinated or not. That's not our role or my role. The parents clearly have more than likely made that decision at this point. But there's simple things that we could do, and Claudia can find the person at the high school. The student council at the middle school makes the announcements, and that's Mrs. Rains, and I'd be happy to contact her. And I'd be happy to either sit with Claudia at the direction of the board and write down some things that would be short, concise, repetitive, easily approved by teachers, so that we can, in fact, ensure the health of our community.
And currently, I'm not sure about the announcement requirements, but I'll look into that and let you know.
I mean, I think the point about immunization and what exactly we say about it is an interesting discussion. I mean, it is a decision that is not strictly a personal decision, because it does have an impact on people around you, which is why schools do have requirements. I mean, influenza is currently required by the state for attendance in daycare, but not for school. I believe the way I hear it said a lot to kind of, take into account that feeling that some people are, misinformed about safety and efficacy and risks of flu vaccine, is something along the lines of your best protection against influenza. Sort of influenza can be a serious and deadly disease even if people are previously healthy, and of course for people who have underlying risk conditions such as asthma, which is extremely common. And as well, part of getting influenza vaccine is to protect those who have a true medical contraindication or are too young to be able to get the flu vaccine, or are too old. The flu vaccine is less effective at a certain point as you age, and so. So one of the best ways to protect yourself from getting influenza and from being infectious to others is the flu vaccine. So something along those lines, but it's certainly an interesting discussion to have.
Well, I would just like to second what I believe is your thought. While I agree that we can't tell people to get immunized, if by the word tell you mean force them, I think from a public health standpoint, we have an obligation to provide people with the information they need to have to protect themselves. And the first line of protection, certainly for this disease as well as many others, is immunization. So I would view it as our role to encourage people to get immunized against flu or any other disease for which a vaccine exists. And I certainly don't think that is inappropriate. Any other discussion on this? Okay, we'll move on to, well, there is apparently no public participation this evening, so we won't have that part. Let me be clear, Mr. Tautone and Mr. Nagel, both. Our agenda indicates that the next meeting of the Board of Health is scheduled for Monday, February 18th, 2013. I believe that is also President's Day. Is the township in business that day, or?
It's not a holiday for us anymore.
Too bad for you. Okay, then our next meeting is in fact scheduled for Monday, February 18th, 2013 at 5:00 p.m. in this room. And with that, we'll adjourn tonight's meeting. Thank you.